welcome to all of you to Switzerland here on the Swiss Pavilion at not CES Las Vegas, but VivaTech Paris. Wow, it's the end of the week. We are a little bit tired. Welcome to all of you. We have many countries here on the Swiss Pavilion or remotely connected. So hello to the camera and to the audience online as well. So many countries for creating the innovation of tomorrow together, because it's really and clearly the motto of this pitch session together. So for this last pitch session at VivaTech,
last but not least, Sylvain,
of course, because
it's going to be the greatest, maybe.
Because we are speaking about health tech, so very important for the future. We'll have France, South Korea, we'll have Germany, Tunisia, and many other countries. With
Canada, Korea, Canada, France, Monaco. Monaco.
Yes, I don't have Monaco. Yes, I am Monaco, France, but with a French flag.
Yes, I don't know.
Okay, great. So I remember the rules. So the rules are clear. It's 90-second pitch. Okay, we slide. You are remotely connected. Don't forget to all startups to say a few words about what you are looking for, because you have an audience here in Paris or remotely connected. We have a jury as well, with the president of the jury, Gilbert. Please, no,
Gilbert is a tech for Sylvain. The presidents, Denis and Fred are connected, and let's connect it with them. Are you connected, Denis? How are you doing tonight?
Connected and kicking. Yeah, very good. Thank you for inviting me to be there.
Okay, the sound is not perfect. What's going on, Ines? Let's try again. Say something again, Denis. Denis is hard.
Do you hear me? Yes.
Doing something that we could help to have the due diligence and to know exactly the quality of your technology. Nothing on the slide, Ines. Is there any problems on it? Okay, say something. Did you? Maybe we have lost Denis. I don't know. Yeah, it's there.
And please, remotely connected, please use a microphone, because otherwise the sound is really and definitely bad.
Okay, so on stage we also have some jury members, but first of all, I would like to give a very, very special thanks to Ji-Yoon. Ji-Yoon, come on stage and introduce yourself, because you have done a so great job. Ji-Yoon, who's coordinating my global village right now for Korea, ladies and gentlemen. A very, very warm applause to Ji-Yoon.
Hi guys, so we are from the Korean delegation. We are supporting 6 Korean startups supported by the Ministry of SME and Startups. So we are very pleased to attend to VivaTech 2022 today, and also give you opportunity to come to Korea if you are interested, of course, to expand your business in South Korea. I'm the person. So thank you.
Thank you,
enjoy
Ji-Yoon.
the pitch, and then bravo to all the startups.
You did so many great job. Dr. Bougon, are you connected? You know, we had problem, but now I think we see you definitely. Are you on a good mood, doctor?
Yes, I am connected. Okay, no problem.
Okay, Fred is super specialized in innovative health, and we are very proud to have it. And then let's move on to the African team. Eichel, where are you? We have lost Eichel. Come on stage and bring your guest on stage. You have 25 seconds to present all the jury you gathered tonight for us. Come closer to the microphone in front of the camera, please. Camera is there, Eichel. Here. Allez, introduce the jury, and jury, come beside the Eichel. He will introduce you.
Okay, so I will introduce, first of all, Munira Hamdi, yes, he's a part of the jury. Come here, Ihab, please. Ihab, please.
Okay, come on, quickly. We have 30 seconds. Go ahead. Okay. Very
quickly. Okay, we have 2 from Tunisia, Ihab and Munira here.
Yeah.
Okay.
You don't know everyone, but introduce the one you know.
Okay.
Okay.
Menad here. He's an IT consultant from Oracle, and an ex-deputy mayor. Stefan Tiki, he's an ex. How I can describe Stefan as
he's super. Introduce yourself. You have 1 second, Stefan, because you are very, very short on time. Go ahead. 2 seconds to introduce yourself.
Myself. It's so hard to speak English because I represent the Francophonie. My job is to speak French, so I will speak French just a little bit. If you
do it very well.
Je suis directeur du groupement du patronat francophone.
And
avec
that's
une
it.
seule mission, installer toutes ces boîtes francophones dans tous les pays en parle français,
Okay.
80 pays francophones avec 22 millions d'entreprises dans le monde, PME, TPE, start-up, ETI, et félicitations au collectif.
Okay, for the rest of the jury,
Okay.
thank you, Sheikh, for the presentation.
Alors,
1
Sheikh
second.
Keita, je suis président de Open Business Africa. I am president for the Open Business Africa and second company, Bridge of Innovation. I am also ambassador for the UN. I'm here to look at the startup. I'm very glad to be here. We change the world with the startup. Thank you.
That's great, very great. Gilbert,
Yes.
1 sec.
Thank you. Amazing spirit, really great energy for the CCE, conseiller du commerce extérieur, and I'm the president for ICT in digital economy.
Jean-Pierre,
Yourself,
Astrid, go very quick.
Hello, Jean-Pierre Bien-Aimé, Chairman, Ubiquity Consulting, and happy to support my Global Village for this pitching startup juries.
Astrid Supervielle, I'm consultant in strategy and business model for company.
Okay, now you see that you have a tremendous jury.
Thank you, everyone.
Denis is remote, Fred is remote. Do we have forgotten remote some of the jury? Obviously, but it's time because we're short on time to start the competition. Who's going to be the first?
First company for pitching today during the last session at Vivatech in Paris, a French company from Nice, south of France. Chalenge, are you with us? Or remotely connected? No, in person.
Hello, everybody.
Remotely connected. Okay.
Yes, it's okay.
So you can share your screen.
And start.
You have the lead of your presentation.
Come on, share the screen. 90 seconds to convince. And TreeMed is supported by the Principality of Monaco.
Excellent.
Can you share your screen? Est-ce que tu peux partager ton écran?
Ouais, je le partage. On m'a dit qu'on le partageait, c'est pour ça. Mais
oui, c'est le premier dans la présentation globale. C'est Sylvain. En premier. Passe en premier trimestre. Il y est dans la présentation.
Please, we're online.
We
go to the second candidate.
We share the presentation.
Je veux bien, ouais, s'il vous plaît.
Okay, during this technique, yes, here we are. So you have 90 seconds. It's the rules for every startup. Are you ready?
Yes. Hello, everybody. Hello.
Okay.
I discovered the pharmacy at the age of 14 during my internship period. Then I obtained the degree of Doctor of Pharmacy, and I worked in more than 40 pharmacies in France and abroad. Around €1 billion of unsold products are wasted and thrown away by pharmacy, wholesalers, and manufacturers each year in France. I decided to change that and to find a solution to encourage a new way of responsive consumption that would help to protect the environment, to reduce wastefulness, and help pharmacists to reduce their loss as well. I created a collaborative platform, a B2B marketplace, to buy and sell soon to expire health products between pharmacists with discounted price. And recently, a new B2C marketplace for pharmacists to sell their soon to expire health products to consumers with affordable price. Besides, the platform provides the possibility for the pharmacist desiring to help disadvantaged people to make donation to association and allows tax exemption. This is TreeMed's team. I'm Giannicola Vincenti, a Caliphate pharmacist, founder, CEO, and they are my collaborators, Sylvain Lepetit, Cédric Kiss, and Sad Lachab, and Arnaud Fournel. Our duties are to protect our environment and to fight against waste. Thank you.
Thank you very much, and stay with us for the questions. Dear jury members, prepare the question for any of our candidates. Who's going to be the next?
Yes, we will start the Q&A session after the first company. So now we leave Europe and we go to Asia.
Let's move up to Korea. Where is our candidate?
A great audience from South Korea is great. So welcome to Europe and welcome to
Korea
Switzerland.
already was awarded with Monica. You have to be awarded too. Okay, go ahead, guys.
Cirroscope, it's your company. You have 90 seconds. Good luck.
Okay. Good evening, everyone. I am Jamie Park. Where we develop the world's first digital diagnostic solution for thyroid disease. There are 400 million patients that suffer from thyroid dysfunction, and 90% of them are chronic patients who have to take medications every day and for the rest of their lives. So the biggest problem for the patient is that there is no alternative for patients to check their disease status other than to take a blood test in the hospital. So what we developed is a technology to predict and monitor thyroid hormone levels on a daily basis from biosignal data of commercialized wearable devices, as well as personal health records. Second solution is second problem is that the thyroid eye disease, which is a complication of the dysfunction. And as you can see here, it can leave the after effects in a cosmetic and functional. So what we develop is we can provide the 1 minute to predict thyroid eye disease with the smartphones, selfies of the smartphone, as well as the 2 symptom surveys. And there's no specific competitor to our solutions. No, there is they just provide recording solutions, but compared to them, we believe we have the competitiveness edge, both cost effectiveness as well as the service coverages. Thank you.
Thank you very much. Very, very good job. Very good job.
A very good job. As timekeeper, I have no job. It was perfect regarding the timing. So back to Europe, but not back to France, back to Monaco.
Okay,
exactly.
one more.
Remotely connected, I think. You are online, right? With Infineis.
Yes, I'm here.
Please mute out your microphone. Are you here,
yes.
Steve?
Yes, I'm here. I can hear you.
Okay, great.
I will share my screen to present you my PowerPoint.
Exactly.
Okay. Okay, we see the presentation loud and clear.
Set.
Okay.
Good luck.
Go ahead, 90 seconds to be convincing for the jury. And one more presentation, and then here to remembers, please prepare the questions for the candidate.
So good evening, everybody. Many thanks to be there. I am Steve from Infineis. And before I start, I would like you to imagine how it could be hard to be diagnosed with a brain tumor. This is sadly, but that's what happened to around 300,000 people around the world each year. Of these people, 2/3 of them don't have access to a safe and affordable surgery. In fact, they won't be able to survive to this pathology. The last third will be treated with very invasive surgeries only if highly qualified surgeons are available. This is so unfair because today we have the abilities to change that. And this is why Infineis was born, to make that change. Thanks to medical imaging, AI, and 3D printing, Infineis provides a new surgical device to guarantee to all people a fair and safe access to the brain surgeries. Our patented device reduces the current processes from around 3 hours to 15 minutes at a fraction of conventional costs. Our first clinical trials have been successfully done in the vet field. We are presently incubated in Monaco Tech, and we are in process of fundraising to address the human medical field.
Yeah. Thinks of moving your slide if you want. No, Steve.
Oh, okay, sorry. And this is the end of the presentation. So sorry for the slides, I forgot that. So thank you for your attention.
Thank you so much. And don't worry about your slide, because it's possible for the audience to find all presentation of the website of My Global Village.
Please, pense à démuter ton écran, Steve. Thank you. Very good job.
Congratulations. So now we stay in Europe, but we go to another big country with Germany. Germany from Berlin. I think you are here in person with AI driven. Are you here or remotely connected? Here, Germany.
Germany, where is Lindera? They were here sooner. Lindera einmal.
GmbH.
Lindera zweimal. Lindera dreimal.
Keine Lindera.
Gleich geht's weiter. Okay.
Okay, no problem. So let's start the Q&A session with jury members. Please don't hesitate, remotely or here in person, to ask all your questions if you have any.
Oh, guys, do you have any question for any candidate?
Ah, we have Lina. No, we don't have Lina. No, sorry. No, it's my fault. Okay, join members, please. Join me.
Who wants? Okay, first question.
Hello.
For which candidate?
For Infineis, the last one.
Infineis, yes, remotely connected. Then Denis has a remote question too.
It's for Denise. Yes, since we had not the opportunity to see your slides presentation, I would like to have a bit more details on your technical features, please. Thank you.
Okay, can you share screen and comment them in 10 seconds, Steve?
Okay, to explain to you, it's a kind of stereotactic device which is personalized to the patient and with the dedicated to the requirements of the surgeon.
Excellent. We have a question online.
Denis, your question, please.
Yes, I have one question for the first startup and one for the second one. First question for the first startup is about the legislation about reusing the end-of-life medication. And the question for the second startup is about the training of the algorithm of the AI. What is the impact of the genre and also the if it's the people coming from Asia or people coming from Europe, there is a lot of difference. So the training of the algorithm should be impacted by that.
Okay, first question, for which company do you have the name, Sylvain?
Trimeds.
Yes.
For Trimeds in Monaco. Can you answer to the question, John Nicholas?
I'm a pharmacist and I respect the legislation. Usually the pharmacist buy products to wholesaler and manufacturers and laboratory. And me, I want a new mode of consumption and a circular economy between us. And 1 month before the date, the products are suppressed in the marketplace. So people can use medication just before the expiration date. I hope I have an answer to your question.
Thank you.
Thank you, Denis. Another questions? Maybe Fred, I don't know if you have a you have also a question for the second candidate from
the
Korea.
South Korean company.
Yes,
if you can...
the question, do you hear the questions? Okay, go ahead.
Algorithm.
Basically, we collect the major, the variable is the heartbeat. So we eliminate the noises from the 1 minute collected, 1 minute unit heart rates. And then we calibrate the heart rate with the blood test, recent blood test results, so that we can track the, by monitoring the resting heart rate of the patient, we can predict the thyroid hormone level of the patients on a daily basis.
No more questions, guys. Jury, if you have some more questions, even for the first candidate, we will try for the second series.
Exactly.
Who's going to be the next?
We have to go ahead because we have 4 companies to go and we have 10 minutes. We will leave Europe for going to North Africa, Tunisia with Data Vacuum. Data Vacuum, are you with us?
Data Vacuum, are you connected from Tunisia? Eichel, where is your candidate?
No,
okay,
Tunisia.
No candidate from Tunisia. Okay,
no
too
problem.
bad.
We continue with Montreal, but Montreal in France or Montreal in Canada, Mackenel, because we have in both countries this city enough to learn.
I confirm this is Montreal, Canada, and the candidate is just beside you. The clicker is there.
Excellent. Welcome, welcome. Jump on the stage. Take the clicker. You're all set, I think, with the presentation, McLennan?
Yeah, it is.
Okay, so good luck. 90 seconds.
Thank you.
Hi, everyone. So, hi, everyone. So, can you guess what this is? So, believe it or not, this is how many of our nurses are trained as of today. So, some years ago, a Montreal hospital came to us and asked if we could do better. And we did. Enough to Learn was born. Our solution? Medical device simulators. So the way it works is actually pretty simple. So we have devices that look exactly like the real medical devices, but how they behave and how what you see on them is actually controlled by somebody using a phone app. So we made 6 of those devices. We sold them to over 180 institutions. And still, we feel like we just started to scratch the need. So because we continuously receive requests for simulators that actually do not exist. So on the business side, our sales have been going pretty good and show a clear market fit. But we know we can do better. And that's why today we're looking for an impact partner ready to invest $2 million and help us speed our growth. So today is your chance to join this winning team. That's it.
Thank you very much and very good job. Very good job. And thank you for your applause, guys.
We were in North America, we were in Asia, we were in Europe, back to Europe, in Germany, Berlin, with Mama Health. Are you with us? Yes, you are.
Mama Health from Berlin.
Building the largest health data platform. Jump on the stage, take the microphone, and good luck.
Thanks a lot. Hey, everybody, excited to be here. I'm Jonas from Mama Health. I'm a medical doctor by training. And nowadays, healthcare system makes us medical doctors behave a bit like this guy. We don't have a lot of time to talk to you as patients, and we often cannot give you the emotional support you're actually needing. Maybe we're as genius if you're lucky. However, there's a group that can help you with these needs, and these are other patients that are exactly like you, not only with the same disease, but that actually have the same symptoms, maybe deal with the same problems every day, same age group, same sex, and so on. If you think about it, it's very hard to find those patients nowadays. What do people usually do? They go on social media, often Facebook, and they literally type, "Who here is like me?" Well, that doesn't work so well. Information gets lost, you get misleading peer advice, and often you don't get the emotional support you need. This is where Mama Health comes into play. On our platform, you tell your story with a chatbot in a very conversational way, and we collect you to other patients who are exactly like you. You can talk to them, you can learn from them on a platform. What has helped them? What did they do with how are they coping with their disease? You can imagine that this data we create this way is incredibly valuable. It's real-world data about the real patient journey. This is what we sell as a SaaS product to all kinds of life science companies. This is our amazing team. If you're an investor or pharma company, you want to join us, feel free to reach out.
They are good, very, very good job. You did very well.
I am personally a fan of Dr. House, so
and I am personally fan of Berlin, so
Berlin as well.
But we don't vote. That's the problem. We are not jury member.
So it was Berlin. It was Berlin here in Paris. What a great image! Last but not least, company for this last pitching session of the HealthTech show here in Paris from Belgium. Please join me on the stage. Big Boy System. Tell us more about that. Sure. 90 seconds. Good luck.
Thanks. Hello, everyone. Hello, people on the internet. So my name is Sam, and I'm from Big Boy Systems. At Big Boy Systems, we developed what I'm wearing on my forehead. It is a camera that is made to record human experience. So everything that you live goes through your eyes and through your ears, and that's what our camera records. Everything is recorded in 3D, and we use binaural sound for the audio. In the end, you end up with a recording that's that's why we're here in MedTech. It's because we use this with surgeons, for example. So we put the camera on the surgeon's forehead, and it's going to record this surgical operation. Students can watch it in real time or in replay, and they will have the feeling of being, instead of the surgeon, in the theater block. And so they will understand all of the gestures and every interaction that happened inside of the block. It's very easy to use because anyone can record with it and anyone can watch it as well with any type of VR headsets, even the cheap Google Cardboards where you use your smartphone inside. You plug your headphones in, you have the immersive sound and the 3D vision, and you have a full grasp and understanding of what is going on, what is happening in front of you, which is not really you, which could be the surgeon, which could be anybody else. Yeah, that's it. I don't know if I'm doing 1 minute 30 here, but basically the idea is that we can transport anybody into somebody else's experience, and it gets you a real grasp of the place, and it helps you to understand anything that is going on in front of you. There you go. That's it for me. Thanks a lot.
Very, very good job and impressive.
1 minute and
pitches.
21
We're
seconds.
still on time, huh? Are we?
Exactly, perfectly on
Swiss precision, always.
It was our last stop today for this pitching session on the Swiss Pavilion. So now let's start the second Q&A session.
Okay,
with the jury
Q&A
members.
session. If you have any question for the second or even the first series of candidates, it's time to ask your question, dear jury members. Want to ask a question? A question?
Yes, for the surgery camera.
Dennis?
Yes, one.
Okay, go. Yes, we do here on remote, but please turn on your camera if you have a question to ask. Denis, no questions? Yes, Fred?
Yes, how do they clean the camera for the surgery?
Oh, yes. Thank you, Dr. Bougon.
So
Thank you very much.
That's a great question. Thank you. So we use, our camera is made in nylon SLS print. So it is a low bacterial material. So it's very easy to clean with any type of alcohol. And basically the surgeon never uses his forehead during your surgery. If a surgeon touches his forehead, he has to go back out of the block, starts cleaning himself again and start over. So the forehead is a free space in surgery. Of course, nothing has to fall, nothing else to drop. So it is quite important for it to be very sanitary.
Okay, thank you.
Thank you for your questions,
Thank you very much.
Dr.
We have
Bougon.
another question here in person, Machinel.
Okay, a question here. Go ahead,
Yes,
Astrid.
please.
Your question, please.
For you.
In front of the camera, Astrid, please. Okay, yeah. Go ahead.
My question is, can you clarify if it's a support to train or to help the surgery?
Oh, well, it can be used for both because you can do live streaming. So you could have an expert helping another surgeon through a surgery if it's a very specific surgery. But mainly we use it for training because it helps the student to better understand the whole situation and what is going on. And as you know, you can't take as many people as you want into a block for infectious reasons. So you have to limit that. But that also means that all your students don't get to see all the operation at the same time. And so you have disparities created between your students. So that's what we're trying to avoid.
Ali, another question for another jury from Tunisia. Tiens, in front of the camera, if you can. Go ahead. That's great. Okay, for which candidate?
Eine Frage für unsere Berliner Freundin.
Yeah, but you have to translate it in English. In Switzerland, every area,
Okay, to what extent can we select the level of confidentiality we would like to share with strangers? Can we set the level of details we would like to share with other patients? So if I would like to find someone which has the same disease, but I don't want to tell all the details because some disease can make that you don't want to communicate that much with a stranger, can I select the level of confidentiality, not sharing my name, not sharing my face, etc., etc.?
Jonas, your answer, please.
So of course, first of all, your data is safe on our platform. We are fully GDPR compliant. However, the more level of detail you give to us, the better we can find others who are like you. And in the future, we also combine this with other health data, even maybe wearables, digital biomarkers to find others who are even more similar. But you always decide how much you share. And the more you share, the better we can help you.
Excellent. I think it was the last question. Do we have any very, very last question here?
One last question. No regrets. Online, remote, no more question. No more question here. I think it's all right like that. So
I think it's all right.
Please, dear jury member, with the device, end up your vote, please. And in the meantime that you end up, let me remind you that every winners, we're going to have 3 winners tonight. But of course, even if you have not won, you can be contacted by our collaborative searcher. And of course, from September, every My Global Village will offer tech review. It's not a competition pitch, but a review of all the best technology we have found. And we will offer you this review 8 major events on the CES South of Vegas, on major events everywhere, / Mobile World Congress, Web Summit.
CES Las Vegas as well.
And hopefully we will be together, Sylvain. The major event, we will showcase your technology. if you win, you're in the top 3. That's assured. So you can come to Vegas and you'll be focused and showcased. Of course, if you want to stay remote, in both cases, you'll be showcased. That's what you're gonna get. Have your hand up? Is the vote closed for everyone? Dear jury members, the same for you, Denis and Fred.
And before having the results, so it was an amazing pitching sessions during 3 days, wasn't it?
Thank you so much.
We had more than 70 startups from many countries. We had France, Monaco, Belgium, Luxembourg, Germany, South Korea. We had the US, we had Canada, and of course, Switzerland, Tunisia, and many other countries, because starting a discussion together is key, innovation together is key, and exactly the target of this great My Global Village program. Do we have the results?
Yes, I think that the 3 have appeared right now. Something's going on right now. I hope what's going on, nothing happens anymore. But I think we have seen the results.
Yes.
Okay, the 3rd one is Ferroscope. One more time. Korea has been awarded and will make the world tour of the HealthTech Global. InnovLearn, number 2, and number 1 from Belgium. Big Boy Systems, guys. Congratulations. Please jump on stage, dear candidates. Canada, Korea, and Belgium. Isn't it a good proof of the global village within the HealthTech? Guys, you did really, really great. Denis, you are involved in the Belgium and in of course, the Walloonian community in HealthTech. Are you happy? You mute up your microphone.
Yes, I'm happy. And I already know Big Boys because I was also active in the first accelerator they were working with. So very congratulations, very good.
So I'm very happy that it handled well for, of course, Belgium, Switzerland. We have awarded company in many sectors, but of course, very proud that you from Korea had been awarded twice, and tonight, of course, Quebec and Canada. And for all the candidates, keep in mind that you can be connected and contact for the rest of My Global Village HealthTech Global Challenge. That's it. Your conclusion, Sylvain.
That's it for
one more
this
time.
VivaTech
Super, very
My Global Village. It was so great to have all of you during these 3 days. So many countries here on the Swiss pavilion. Let's continue to discuss together. Let's continue to innovate together. Because for the last time, Mark Lionel, I will say for the last time, together we are stronger. So it was my motto during this week.
Ladies and gentlemen, please a super warm welcome to the Swiss Tech team and for Sylvain, guys. They were super hosted, and all the booth and all the exhibitors, they were super great. Sebastian, the technique, all the team, thank you. Hope to see you next time. And we start again in September with a huge. Next, My Global Village will be on Formula 1 Grand Prix of France, the 22 with the Mobility Challenge. So if you have innovative solution in mobility, please stay tuned. Formula 1 Grand Prix of France, 22 of July. Bye-bye.